Hello, this is Mike Gatorno with SEMA, the Senior Insurance Marketing Association. Today we're going to find Medicare Part C, Medicare Advantage, and Medicare Part D plans in your area using Medicare's website, medicare.gov. As you can see, we have Medicare's website up. If you're not familiar with this website, it's definitely worth looking at. There's lots of information here, not only that we could find useful as insurance agents, but also to see what the consumers are looking at when they go to Medicare's website. So definitely, if you're not familiar with it, take some time, look through it, and see what information your potential and current clients are finding. Now, to find health and drug plans, there's two options. The first one on the main page here, you can see there's a button, Find Health and Drug Plans. Or if this page does change throughout the year, you can come to the first tab, Sign Up, Change Plans, and again, there it is, Find Health and Drug Plans. So we'll just click on that. The next page will be our Medicare Plan Finder. As you can see, there's two options. We could do a general search, which is just zip code based, or we could do a more personalized search, which will save the information for when they come back to Medicare and sign in. But today we're just do a generalized plan search. So I'll put in my zip code and click on Find Plans. Now the step 1 of 4, we're going to need to enter information, how to get your Medicare coverage. Now for this, you have a couple different options. I'm going to choose Original Medicare just to keep things nice and easy. It will have a couple of check boxes for us to choose. We're going to bypass that, again, just for a general search. And then it'll also ask us, do you get help from Medicare or your state to pay for your Medicare prescription drug costs? We're going to click on I don't get any extra help, again, just to keep things simple. If you want to see what those other options do, feel free to come through here, click on some, and see what kind of plan results you get. But again, we're just going to click on the basics. Next page will ask us to enter in our drugs. And as you can see here, you could list a maximum of 25 drugs. So you're sitting with a beneficiary and they have a list of drugs and they want to enter them in to get an idea on cost, you can do that. But if they don't take any drugs, or if you, again, just looking for a general search, you can choose one of these two buttons, which right now we'll pick I don't want to add any drugs now. It'll ask us if we don't enter in any drugs, it'll give us a national average, and that's fine. We're going to skip drug entry. Now, you'll notice this is step 4 of 4. Step 3 was to choose a local pharmacy. But since we skipped that option of entering in drugs, it skips that process for us. So here are our plan results. As you can see, there are 48 plans available in my area. And I have 27 prescription drug plans, 14 Medicare health plans with drug coverage, and 6 Medicare health plans without drug coverage. We're going to select all just so we can get them all on the screen and continue to plan results. Now at the top of this next page will be a legend to show some additional benefits such as dental, vision, hearing, and nationwide coverage. Now the current plan we picked was Original Medicare, so the current plan will always pop up first. Next is prescription drug plans, and as you can see, we could sort results by a variety of different factors. And the default one is lowest estimated annual retail drug costs, so we'll just leave it at that for now. And you can see it shows here an estimated annual drug cost. Again, this is just a national average, monthly premium, deductibles and drug pays and coinsurance, drug coverage if there are restrictions, and overall plan rating. Now, to the far right, you'll notice that there's an enroll button. All the plans on Medicare.gov have the enroll option. So if you want to go ahead and send your clients here to tell them to enroll, it will bypass you as the agent. So be aware that if you send your potential clients to Medicare to shop for plans, they can bypass you as the agent and enroll on their own. So it's good to know that that option is on here, so you don't send them here for or use this tool as your Medicare quote engine. We'd recommend using a quote engine through some sort of carrier FMO. So when they do enroll, you do get credit. There's more on SEMA about that. Now we're going to close this prescription drug plan by hitting the collapse button here. And we're going to look at Medicare health plans with drug coverage. Again, we could sort results by a variety of different factors. We're just going to leave it at the default. And similar overall plan information in the beginning, estimated annual drug costs, premium, deductibles, health benefits, drug coverage, estimated annual drug costs, and overall plan rating. Now, the nice thing about Medicare.gov is you could print out almost a overview of a summary of benefits, and you could do this by choosing the plan you want to print that for. This will give us a little more detailed information. As you can see, this next page gives us pretty much a generic overview of the plan. But we're going to want to pick health plan benefits. Give us a little more detailed information, but to get the most detailed information, we want to view more detailed cost and benefit information. So we'll click on that. It will pop up a separate window, and it'll give us almost, again, like a mini summary of benefits. We'll give us premium, it will give us prescription drug costs, including copays for retail and mail order. And then as we scroll down, go to benefits, it'll give us hospital information, inpatient care, skilled nursing, outpatient care, which will be your doctor visits, specialists, so on and so forth. The nice thing about Medicare.gov, it'll give us the option to print this report, so you can keep this with you. If you are talking to someone that has this plan, they're not sure on a copay, you can quickly look it up for them if you're comparing their plan to a plan that you're offering them, or just for your own general knowledge. And the nice thing is this is a Medicare approved piece. So if you're talking to someone with Advantra HMO here and you're showing them a different plan and they're trying to figure out what their doctor copay is, you could pull out this printed report, show it to them and say, look, here's your doctor copay according to Medicare. So for more training and for more information about how to use different tools, feel free to visit SEMA and join one of our webinars or explore the sections on there. And we look forward to seeing you